Let's start. First of all, I'd like to welcome everybody to this pep talk. As a reminder, please mute yourselves, but always show your video picture. Please sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk. Another reminder, after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. The link is already in the chat box. Another reminder, obtaining 50 or latest certificates will entitle one mentee to a voucher, free voucher for a ROJoson telemedical consultation like this. This is the picture of the voucher. Another reminder, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. One, two, three. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Neck Masses, Bukol sa leeg, neck masses, or neck lumps. This is in consonance with the Department of Health Awareness Calendar, in which they declare the last week of April as the Head and Neck Consciousness Week. But today is already May. This is just a continuation of our contribution to the Head and Neck Consciousness Week. Okay. So the title for today, I have taken up Head and Neck Wellness Awareness, then Head and Neck Cancer Awareness last week, and then this time it will be on neck masses. The empowerment objective is for the lay people to have a basic understanding of neck masses in their health management. The contents of this particular pep talk this afternoon will be when and what is the Head and Neck Consciousness Week in the Philippines, what is the head and neck, what are neck masses, what are the different types of neck masses, what are the different causes of neck masses, and what are the more common neck masses in the Philippines. What are the different types and causes? What are the more common neck masses in the Philippines? How to recognize common neck masses? What are the usual diagnostic procedures for neck masses? What are the usual treatment modalities? And then what are my advice on how to manage neck masses on a personal or a lay people level, layperson level. The last week of April is Head and Neck Consciousness Week. This is declared by the Presidential Proclamation of 2008. And this particular week or this event will be to increase the public awareness on the cancers of the head and neck region, particularly the more common ones, which are the oral cavity cancer, nasopharyngeal cancer, laryngeal cancer, and thyroid cancer. And also the objective for this particular week, declaring this week as a health Head and Neck Consciousness Week will be to promote primary screening, prevention, and early detection, and also optimal treatment and care. So, but for this week, we will call it Head and Neck Mass Consciousness Week. Okay. What is the Head and Neck Consciousness Week in the Philippines? Okay. As we mentioned, it's a week to make people aware of the different types of cancer. It's also a week to empower people on, for this week, we will declare it as Neck Mass Consciousness Week. So this is a week to empower you, the lay people, on neck masses. We will be focusing on neck masses this week. So what is head and neck? Head and neck refers to the region in the human body, the head and neck regions. The head is the uppermost region of the human body when the person is in the standing position, and the neck is just below the head, and then which the neck connects the head to the chest. So this is the neck part, which we will be focusing on today. But again, on the surface, to divide the head and neck from each other, we use an imaginary plane passing through the lower part of the jaw. Okay, but this is just a guide. Okay, so whatever is below this imaginary plane is called the head, as long as it's above the chest, and whatever is above that is called the head part. So masses below the imaginary plane, as I mentioned earlier, okay, are considered neck masses. Everything below this imaginary plane will be the neck masses, as long as it does not encroach on the chest region, in which case it is called masses on the chest. So what are neck masses? Again, masses below that imaginary plane. So it can be in the front of the neck, or at the back, or the nape. The key organs and specialized tissues within the neck regions are the following. There are a lot of them. Okay, so you have the neck skin and soft tissue. Yung balat ng neck is one part of it, and then below the skin, the soft tissue will be part of the neck also, as long as it's within the region of the neck. And then the lymph nodes, the thyroid glands, parathyroid glands, which are behind the thyroid glands, trachea or the windpipe, lower throat or the hypopharynx, esophagus. The neck part of the esophagus is, as we know, the esophagus is a long tube connecting the mouth to the stomach. Okay, so the chest part will be the chest esophagus, whereas the neck part will be the neck part of the esophagus in that area. Then blood vessels, nerves, and muscles. So when you say neck masses, it's the same thing as saying neck tumors or neck lumps. So we can use these terms interchangeably. So neck mass or a tumor or a lump. So this is the general definition of a mass or a tumor or lump. It's an unusual or abnormal collection of tissues occupying a space in any area or part of the human body. It may be of any shape or size. It may be of any consistency, whether it's hard or soft, whatever, no? And then it may be cystic, solid, or complex. Complex means a combination of cystic component and solid component. Then by itself, when you say a mass or a tumor or lump, it can be of any etiology, any causes. Basically, it's either whether it's cancer or not cancer, until determined by further assessment. A lot of times people, when they say something about mass, tumor, or lumps, they connote it with something already. But at the very start, it can be anything. It can either be cancer or not cancer. Then the only time that you can determine what it really is, you have to determine the various characteristics. Example, the consistency. If it's hard, okay, hard usually it tends to be more on the cancer diagnosis. If it's cystic means it most likely contains fluid. It's more on the benign or non-cancer. Okay, then The mass can be of any size or shape, but it does not give the diagnosis. It does not contribute to the diagnosis. What will contribute to the diagnosis are at least these two: the consistency, cystic mass, and cystic or solid mass, complex, and other data like the presence of neck nodes, the presence of areas of spread or invasions. Okay. So when you say mass, tumor, or lump, it's generic. It's a walang connotation pa, okay? It's just there's a possibility whether it's cancer or not. A mass, tumor, or lump has to be differentiated from prominence, induration, swelling of tissues, and enlargement of organs. Okay, so a lot of times these are mistaken for tumor. Okay, when you say prominence, it's more protruding than usual, but there's no space occupying mass. Mas maumbok lang, wala talagang bukol. No? Induration of the tissue means it is thicker or harder, medyo matigas ng konti, but there's no space occupying mass. Example will be parang yung mga kalyo. Kalyo is not really a mass, it's just a induration, makapal lang. Swelling of the tissues without an accompanying space-occupying mass is just mere swelling. We don't call that mass. No? Bukol, namamagalang. Okay? Enlargement of an organ without an accompanying space-occupying tissue is also called just an enlargement. It's not a mass. So we have to know how to differentiate these four: prominence, induration, swelling, and enlargement. No? It doesn't have a bad connotation of a mass. Kasi kung kung mass ang pinag-usapan, tumor or lump, we talk about is it cancer or not. But for these three, usually hindi. These four, usually hindi. What are the different types of neck masses? So based on the location of the mass in and on the neck. So that's one way of classifying the types. Okay? Whether it's on the central neck means nasa gitna, central, or lateral, nasa side, neck masses, or the front neck masses could be sa harap. Okay, it can be these two, basta nasa harap. In contrast to the back, nasa backing mass will be called usually we call it the nape, no? Okay. Tawag doon sa batok, okay? Another way of classifying the types of neck masses will be based on the specialized organs or tissues of origin. Kung saan siya nagsimula, yung bukol na yon sa neck. No? If it comes from thyroid gland, we call that a thyroid mass. If it comes from the lymph nodes, we call that from the lymph nodes. Okay? It comes from the parathyroid gland. If it comes from the skin, we call that the neck skin tumor. Okay? Here are the list again of the organs and specialized tissues that may be found on the neck and which can give rise to a tumor, mass, or lump. The third way of classifying the type of neck masses will be based on the specific cell of origin. Okay, sa isang organ, there are a lot of different types of cells. So example will be adenocarcinoma. This is a special type of the cancer arising from yung mga cells which we call yung mga glandular elements, then sarcoma, then squamous cell carcinoma. So this is the third way of classifying the type of neck masses. But this usually comes from the biopsy or histopath results. This is usually given by the pathologist. Okay. Dito, based on the location, we can easily tell just by a physical examination or even by the diagnostic test like ultrasound, x-rays. No, we can tell already what is the origin. Okay, the other type of the other way of classifying the types will be based on the disorders, but strictly speaking, this should fall under when we talk about the causes of the neck masses already. Okay. But a lot of times, people or doctors usually interchange between the causes and the types. Okay? So based on the types of disorder, it can be inflammatory masses, yung mga may infection, may mga inflammations, okay? Infectious ganun din, no? And then non-malignant new growth masses, benign, then malignant new growth masses. Okay? as I said, this classification is closely related to the causes already. So these are the general causes, okay? 4 main causes of neck mass: inflammatory, infectious, non-malignant, and malignant. What are the more common neck masses in the Philippines? Sa Philippines ito, ha? Okay. So the most common are still the thyroid masses. And then next comes the lymph nodes on the neck. Okay. When you say lymph nodes on the neck na presenting as a concern or disorder, usually these are the enlarged one, abnormally enlarged one. Lahat tayo may lymph nodes normally, kaya lang hindi nakakapa, maliliit lang siya. Kung maliliit, normal yon. Kung malaki na siya, kapang-kapa na, now usually we consider that as abnormal. So it's we have to be concerned with that lymph node, the enlarged lymph node. So what are the different causes of neck nodes? As I mentioned earlier, we classified them into inflammation, infection, non-malignant new growth or benign, and malignant new growth or cancer. And to be more detailed in the causes, we talk about genetic mutation, okay, which could be either hereditary or spontaneous. Usually very rare lang ito, mga 5 to 10% are really hereditary. Majority are spontaneous. And then another common cause of head and neck cancer would be smoking, alcohol, then virus, and also radiation, especially for the thyroid gland. So what are examples of the different causes that I mentioned earlier? So when you have inflammation, lumalaki lang lymph nodes, we call that inflammation of the lymph nodes, or we call that non-specific lymphadenopathy. Then an example of infection will be tuberculosis of the lymph nodes is an example. Infection of the larynx, laryngitis. Then for the benign new growth, we have the benign thyroid nodule and benign submandibular gland tumor, which is part of the neck also. Malignant or cancer new growth, malignant thyroid cancer, malignant submandibular gland tumors. So here are examples of its for each type of the causes: inflammation, infection, non-malignant, and malignant. What are the more common diagnostic tests for neck masses? So, but these common ones are being done only as indicated. You have ultrasound of the neck, then needle biopsy, thyroid function test to test the mga hormones of the thyroid gland. The parathyroid function test is another test, another type of test for testing the functions of the parathyroid gland. Common treatment modalities usually being done: surgery, radioactive iodine, usually for thyroid, medications, and chemotherapy. How to diagnose a neck mass? So you have a chief, let's say somebody will have a chief concern that I have a neck mass. Okay. So the first thing that we have to determine is when was it noted? So tatanong natin, kailan ba napansin yon, na-discover, at napuna? Okay. Then look at and palpate the neck to check if a real dominant neck mass is present or not. Kasi kung minsan, may sinasabing pasyente, I have a neck mass. Pero kung kinapa, hindi pala bukol. Baka prominence lang, baka yung mga makapal lang, induration lang. So the 4 ones that I mentioned: enlargement, induration, prominence, okay, and others, okay. Then after that, kung na-determine na talagang may bukol sa leeg, the next thing to do is to check the location of the neck. Nasaan ba? Nasa front central or front side or sa likod, sa nape. Okay? So based on the location, you can have an initial tentative diagnosis just by looking at the mass and then sa neck and then determining the location. Okay? So you can have a tentative diagnosis already, and then later on, some more physical examinations will have to be done so that you can get to a more specific diagnosis. But offhand, based on the location, masasabi niyo pag yung bukol nasa front central, usually thyroid mass yon. Okay? Thyroid, usually thyroid yon. Yung nasa side ng leeg, usually lymph nodes. And then doon sa likod, usually soft tissue mass. Soft, usually, when I say soft, usually, karamihan. When it can be other causes, other types of masses, which I will show you later on. So if the mass is in the front central dito, commonly it's a thyroid mass. But you have to confirm this by asking the patient, or you can do it when you are the one with the mass, you have to swallow. Okay. Once the mass moves with swallowing up and down, then 99% it's thyroid mass. So the clue, the most important clue here is a front central mass that moves with swallowing. Now, if the front central neck mass does not move, hindi gumagalaw, chances are it is something else, such as a soft tissue, like lipoma, like other, let's say, neurofibroma, soft tissue mass, hindi siya thyroid. But 99% usually gumagalaw siya. No? So, now, here is a note that yung sinasabi kung di gumagalaw, nasa gitna, okay, sometimes kung may cancer na malaking-malaki na, hindi talagang gagalaw kasi fix na yun. No? So this is an exception to this rule. Now, if the mass is in the front lateral, nasa side, commonly, it is a lymph node. Okay? So you should ask the patient to swallow just to check, kasi kung minsan malapit yan sa gitna, no? Pero nasa side. Pero once it moves to deglutition with swallowing, it's still part of your thyroid. No? But if that's not moved, then it is usually a lymph nodes, yung mga kulani dito. No? Okay. Now, if the front lateral neck mass does not move with swallowing, as I said, 99% it is a lymph node until there are data to consider something else like a soft tissue tumor. Or you can have lipoma and other soft tissue tumor on the side of the neck. Okay. So ito yung itsura ng lipoma. So yung definitive diagnosis will be based on the more detailed findings of the mass based on examination. If the mass is on the back of the nape, more common, it's a soft tissue mass. Okay. As long as it is not located at the usual lymph nodes areas. Dito sa likod kasi may mga lymph nodes din siya, no? But usually dito sa taas, no? And also on the side, on the back side. Ito, dito. Kung may bukol ka somewhere here, you have to consider a lymph nodes. Pero kung bukol mo dito sa gitna ng batok, then most likely it's not a lymph nodes. Okay? And most common is a soft tissue mass. How to diagnose a soft neck mass again? Another approach in diagnosis of neck mass after determining its location and source of origin is to use this algorithm. Itong algorithm that I will show you, this is easy. Okay. To decide whether it is infectious, inflammatory, infectious, sabi natin, 4 possible causes, inflammatory, infectious, malignant, or non-malignant. Okay. So the first thing to do is to look for cues for inflammations and infections, such as redness and tenderness. Kasi madali lang hanapin ito yung mapula at masakit. Kung meron yan, then you think of inflammation as the cause of the mass on the neck. So that's why if these are present, most likely it's an inflammatory or infectious. Okay. If none, kung wala yung redness or tenderness, then look for cues for malignancy. Yung possible signs of cancer will be hardness, matigas yung bukol, then fixed, hindi siya gumagalaw, hindi siya tumatakbo sa kabilang lugar. Then, kung meron siyang signs of spread, yung spread to the lymph nodes and to other parts of the body. So if present, then you consider malignancy as the diagnosis. Then, if none, kung walang signs of inflammation, signs of malignancy, most likely, by exclusion, by elimination, you think of non-malignant. Okay. More so, if the neck mass is cystic. Cystic means it might be containing fluid. So once you have a cystic mass, malaking chance na it is benign. So ito yung diagram, algorithm. Look first for sign of inflammation kasi madaling hanapin lang ito. And then kung negative, then look for signs of malignancy. Kung meron, yung diagnosis mo should be malignant. Kung wala, makakahinga ka ng malalim, most likely benign siya. Okay? So some illustrations. So neck masses, you have on the central neck, this moves with deglutition, with swallowing. So most likely, this is thyroid gland. Okay? So you can see multiple nodules. So ngayon, masasabi lang natin thyroid tumors. But as to the specific type, we have to go deeper into our examination to check for other findings. Kung meron siyang kulani rito, most likely this is thyroid cancer. Kung wala, most likely this is benign. Okay? Ito, based on the location, dito sa leeg din. Okay, sa bata, usually it's a congenital, yung at birth, meron siyang abnormality. We call that thyroglossal dapsis. So what are the alert symptoms for thyroid cancer? Okay. So as we said, thyroid masses are the most common neck masses in the Philippines. Fortunately, thyroid cancers is not very common. Majority are still benign sa thyroid. Okay? But we must know what are the cues for thyroid cancer. Number one, there are nodules, single nodule or multiple nodules on the front and side of the neck, sa gitna. And then this moves on swallowing. Okay. And then if there are lymph nodes on the side, then we think of malaking chance na cancer yung bukol sa thyroid. Then if there is this hoarseness of the voice in the presence of a central neck lump, yung hoarseness kasi it's a sign of invasion. Parang in-invade na yung nerve na malapit sa thyroid gland. So if you have a thyroid gland tumor, pagkatapos may hoarseness, you start thinking of malignancy or cancer of the thyroid. So usually dito kung wala pang lymph nodes, walang hoarseness, usually matigas yung bukol sa thyroid gland. So lymph nodes or kulani, as mentioned earlier, it is normal to have lymph nodes in the body as this protect the body from infection or from other diseases. Lymph nodes become abnormal only, we consider them as abnormal if they are enlarged or they contain cancer. Kung enlarged lang, baka ibang usapan, baka inflammation lang. Okay. Now, these are the distribution of the lymph nodes on the head and neck. No? Okay. Marami, no? So this is an example of enlarged lymph nodes. Okay. Lumaki lang siya, usually diffuse. Pag naging palpable siya, then may isang focus of infection somewhere. So we call that inflammatory reactions of the lymph nodes. Okay. And dito naman, one mass on the neck na nakapangkapa. So this is a lymph node and buccal lymph node. Okay. So which we might be thinking of possible cancer. Okay. Example of lymph node at the back of the neck. Dito. Okay. Pwedeng sa harap, pwede sa likod. As we said, ito yung mga distribution ng lymph nodes. Okay. Normally, andyan siya, hindi lang siya malaki, hindi siya nakakapa, normal lang yon. Pag nakakapa na dito, like this one, no, nakakapa na, then we call that abnormal. Okay. So if lymph nodes in the neck are palpable, they automatically are considered as unusual. As usually they are not palpable. So once palpable, it means something is happening. The palpable lymph nodes may either be inflammatory, kung meron kang viral infection like URTI, let's say kung may COVID ka sa throat, no, or colds, no, magkakaroon kang enlargement of the lymph nodes. Okay. And then in bacteria, kung meron kang infection sa bibig, no, mag-enlarge yung lymph nodes mo rin sa leeg. Then infectious, also, when you have TB, example will be TB of the lymph nodes. It's an example of infection of the lymph nodes. And then cancerous Okay? Whether it's metastatic or lymphoma. Usually metastatic means may pinanggagalingan. Sabihin natin, sa thyroid may cancer, pumunta dun sa lymph nodes. So yan ang example of metastatic cancer from the thyroid gland. Lymphoma means yung origin of the cancer primarily sa lymph. Walang pinanggagalingan kundi sa lymph nodes itself. Doon siya nanggaling. Kaya lymphoma, yung root word nito, lymph node, lymph, no? Lymph. Oma means tumor. Common causes of abnormal lymph node enlargement, usually, ito yung in that order of frequency in the Philippines, non-specific or reactive hyperplasia or enlargement, usually due to secondary inflammation from somewhere else, like the virus or bacteria. As I said, if you have throat tonsillitis, throat infection, you can have enlargement of the lymph nodes, which will eventually disappear in due time. Okay. Then the other possible cause of lymph nodes enlargement, abnormal one, will be metastatic. Yung mga may pinanggagalingan na cancer. The last one will be lymphoma and also TB. TB is not very common nowadays, pero pwede mangyari pa rin yun. So, I will tell you my personal experience here just to put emphasis on this topic. So, I had a neck mass, ito, 1 centimeter sa right infraauricular area below the right ear, okay, which was discrete, non-tender. So nung nakita ko ito in 23 years ago, 2000, so ang diagnosis ko sa sarili ko is a non-specific lymphadenopathy. Baka meron akong infection somewhere, baka may dandruff ako, okay, ano, okay. So lumaki, okay. So I just observe it. It has been there for more than 23 years now. Actually, when I examine it today or the other month, it's still there, but it's smaller. It's smaller. So ang ginawa ko lang, watchful waiting. No? Ibig sabihin, walang antibiotics. No? So inantay ko lang mag-subside to whatever inflammation there are. Hindi ko lang ma-pinpoint kung nasaan, pero I just observe it. No? So ito yung bukol na yun, yung lymph nodes. No? So another example of a neck mass here, dito, this turned out to be TB of the lymph nodes. Now, as I said, this is not very common nowadays, but still, we can still see this kind of diseases every now and then. So pag inaspirate mo yan, may makukuha kang nana, no? Pero hindi siya mapula, pero may nana sa loob. No? Ito naman, may bukol siya rito, okay, inflame, mapula, no? Tapos merong fluctuant area, okay. So pag merong nito, usually may nana yon, no? Kasi fluctuant, no? So may nana siya in that area, kadalasan TB rin ito kung andyan yan, no? Ito naman pasyente nito, there is a mass here on the more on the central neck, kalapit sa gitna, no? That moves with swallowing up and down, konti, and then meron siyang bukol sa side of the neck, sa tabi, so which we consider as lymph node. So in the presence of a thyroid mass, and then with a neck node dito, we consider this as thyroid cancer with spread to the lymph nodes. Okay. So ito yung cue that this is a cancer because of the lymph nodes. Kung wala itong lymph nodes, pwede din mag-suspect na cancer of the thyroid kung matigas ito. At kung minsan kung may hoarseness of voice siya, then we consider thyroid cancer. O kaya kung hindi siya gumagalaw. Okay. Okay. Usually pag benign siya, gumagalaw siya, malambot, hindi siya matigas. No? At walang hoarseness of voice. Another example, dito sa medyo nasa likod na, okay, of a neck mass. Okay, this could be a lymph nodes, no? Multiple. Okay, so we have to check kung saan galing. Okay, kung is this primary na lymphoma, ito marami yan, ha? Baka lymphoma ito, marami, no? Or is it coming from metastatic, coming from somewhere, no? Baka coming from the nasopharynx, sa loob ng likod ng ilong, dito pumunta, so nasopharyngeal cancer, no? Okay. So usually yung mga non-specific lymph nodes, hindi siya ganun kalaki. No? Pero kung malaki na ito, we suspect cancer, either metastatic or lymphoma. So other types of neck tumors, sa bata, bronchial clepsis, you can have, the moment you have a child with a mass here, we consider yung mga congenital anomalies at birth. No? Ito rin, cystic hygromas, these were present at birth. No? And then dito naman, bilateral, it turned out to be lipoma. Okay? Medyo nasa baba, no? Usually pag lymph nodes, usually dito sa little side, okay, maliliit lang yan usually, no? Another example of a neck node involvement of the skin. This one, the skin lang ito. So this turned out to be a benign tumor, so which was just removed. Okay. Ito nasopharyngeal tumor na cancer na pumunta sa likod ng ilong, pumunta dito, nag-spread siya sa lymph nodes dito sa bandang itaas ng leeg, now below the ear. Okay. So we think of nasopharyngeal cancer when we have lymph nodes in these areas. So the alert symptoms for nasopharyngeal cancer will be nodules on the side of the neck, which usually the lymph nodes. Okay. Then nasal stuffiness, medyo higpit ang may mga yung sa ilong may hindi maluwag yung paghinga niya. Okay. Then nasal bleeding. Okay. Kuminsan. Okay. But usually these are not very common, but the most common, usually walang symptoms yung nasopharyngeal cancer. Usually, ang unang nakikita talaga yung lymph nodes na dun sa side of the neck. Another patient, you have a mass here, so we have to determine what it is. It's near the pwedeng lymph nodes, nag-inflame, baka meron siyang lesion, meron siyang sugat sa itaas, no? Okay. Or it could be a soft tissue tumor like epidermal cyst, no? Nag-inflame lang, nagkaroon ng infection. So laryngeal cancer, another common neck masses. Alert symptoms will be hoarseness of voice. Once you have hoarseness of voice, you always think of possible laryngeal cancer. And then lalo na kung may lymph nodes on the side, which could be a spread from the laryngeal cancer. So to sum up on this, how to recognize yung mga neck masses will be and possible and diagnose it as to what it is. You look first for the inflammation. Kung walang inflammation, then you look for malignancy. Kung walang signs of malignancy, you settle for a diagnosis of non-malignant one. So the advice that I like to give everybody in terms of management at the lay people level, do your self-examination of the head and neck regularly and thoroughly. Do self-examination of the head and neck. By doing this, you facilitate early detection of any diseases that may affect these parts of the human body. Once anything unusual is felt, is seen, or palpated, you consult a physician right away, as soon as possible. Early detection and treatment of head and neck diseases is associated with a lot of health benefits, such as higher chance for successful treatment and prevention of disfigurement and premature death. Because nasa face yan sa neck, minsan pag malaki na yung tumor, pag ino-operahan siya, the usual type of treatment, ino-operahan, malaking matatanggal, malaking deformity ang mangyayari. Huh? So, summary, takeaway, I have discussed all these things. Head and neck consciousness week, what is head and neck masses, types, common causes, and the more common type, and then how to recognize the neck masses, the usual diagnostic and treatment modalities, and then what are my advices on how to manage neck masses on a personal level. Takeaway in relation to patient empowerment, be always in touch with the reliable information on neck masses. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in neck masses in one's health management. So this ends my lecture for today, my pep talk. I hope I have empowered you to have a basic or better understanding of the neck masses in your health management. Before we go to the QA, reminder, take the OLETE, 50 OLETE certificates, 1 voucher for ROJoson telemedical consultation. Feedback, please type in your feedback in the chat box during the open forum. And then let's now have a group picture taking before we start the open forum. Ready? Kat, are you joining us, Kat?
Yes, Doc, I'm here.
Picture. Ayan. Ganda yung mukha mo. 1, 2. Oh, Christy. 1, 2. Okay. Okay, we still have 15 minutes for open forum. Any questions, any comments, any consultations that you want to make? Free consultations, basta maikli lang. Perla, shoot.
Doctor, are you familiar with TMJ disorder?
TMJ.
Yes.
TMJ, temporomandibular joint.
Yes, kasi nagpunta ako sa dentist ko, doktor, kanina. I was diagnosed with TMJ disorder.
Okay.
Ano po ba yun?
Hindi mo tinanong.
Tinanong ko, parang dito eh. Sa leeg, parang sa joint is, tinanong niya kung sumasakit yung tenga ko. Sabi ko, sumasakit minsan. Tapos parang nagweweng, ano ba yun? Parang may sounds na lumalabas. Ganun daw yun, yung mga symptoms niya.
Okay. Kaya nga, hindi na sinabi yung T. Anong M? Anong J?
Temporomandibular.
Sinabi niya.
Yes, doctor.
Okay. So anong naintindihan mo sa temporomandibular?
Dito, temporo.
Temporomandibular
Mandibular joints disorder. Opo.
Okay. Andali drawing natin.
Temporomandibular joint disorder. O ganun.
Ito yung mandible mo.
Opo.
Okay.
Yan.
Ito yung joint yan. Yung mga sakit. May sakit yan. Di ba? Okay.
Opo.
So, okay. May sakit yan. Usually, ito sa likod. No? So, pag binubukas mo yung bibig mo, parang joint niya sa paa, sa ibang areas ng katawan yan. Di ba? Para may mga lubricants yan, padulas, no? Okay.
Opo.
So, pag parang kung arthritis, masakit sa joint, no? Pwede ding dito, parang sort of an arthritis din dito at sa joint nito. So, ang tawag nito, temporomandibular joint, no? Joint.
Sa loob ng tenga yan, doktor?
Hindi, dito sa dito sa parang sa paa, di ba?
Joint? Sa paa?
Parang sa paa, joint yan, di ba? Joint, di ba? Ano? Pag may problema sa joint, sasakit. But parang we call that knee joint, di ba?
Opo.
Okay. This is another type of joint. It's located on the jaw. Temporomandibular joint is jaw. Jaw. To make it simpler, it's a joint on the jaw. No? So pagbukas mo, no, mahigpit, di ba? Minsan, masakit.
Kanina nga, pinabukas niya, tapos binalik ko, masakit. Masakit yung left jaw.
Doc, may ganyan po akong disorder, may TMJ ako. So, advice ang dentist, panoramic. Dental cross bites daw ako. So, baka after ng operation, magpa-braces ako. Yung kasi yung advice niya.
Braces?
After my operation, baka magpa-braces ako.
Braces. Okay. So, okay. But okay, Perla, TMJ joint, alam mo na kung ano siya. So, it's the joint dun sa may jaw mo. Jaw. So, tanda mo lang yung jaw. Jaw.
Dito. Ang advice na sa akin, doktor, is sinukatan niya ako ng parang ipin, parang dito, ilalagay dito sa loob ng, dito sa bunganga mo, dito sa loob, parang ipin na nakaganon, na ilalagay ko yun. Oho, doktor.
Okay, tanda.
Daw yun.
Sandali. Okay. So, TMJ joint is joint on the yung temporomandibular joint, no? Okay, yung sakit. Yung sakit yan, sa jaw. Pagbukas mo ng bibig mo, makakapa mo yung, di ba? Yan. Okay?
Nagkaganon nga.
Makakapa mo, di ba? Makakapa mo yung gumagalaw yung jaw, yung buto. Okay? So, kung meron kang problema doon, so they call it a temporomandibular joint disorder. No? But you have to know the cause. Okay? Usually baka masakit lang yon, no? Usually the most common is masakit, mahigpit, ganon. But we have to determine the cause. Ano mga causes, di ba? So you can cut baka because of malalignment sa ngipin niya, di ba? Palaging kung ano-anong
alignment nga daw, doktor, sa ipin. Alignment.
Okay,
yung sinabi niya. Alignment.
Alignment, no? So, baka kaya aayusin yung alignment mo. No? Okay.
Opo, doktor.
Okay, so that's one cause. Other causes could be some inflammation doon. Baka parang arthritis na matagal na kasi baka matakaw tayo kapag kumakain. Okay. Biro lang yun, pero usually pwedeng nangyari din yun.
Parang alignment nga daw ng ipin yata, doktor, yun. Yung sinabi niya, alignment ng ipin ko, parang hindi siya if left untreated, doktor, ano bang mangyayari? Yun bang simula ng vertigo? Yung mga ganon?
Theoretically, pwede, pero from my experience, pwede namang pagtiyagaan, we just alalay lang kung yung alignment mo. Ako marami akong parang kulang yung mga ngipin ko because of dental caries, pero hindi ko na pinapa-fix, hindi ko pinapa-braces, gano'n, no? So, alalay lang ako, alalay. So, but you won't die with it naman eh. You won't die. Okay? So, pwede mo pagtiyagaan na lang kung gusto mo. So, yung pagkain mo na lang, adjust mo na lang, no? It's either mga soft lang, no? Okay.
Bawal yung matitigas.
Bawal. Pwede, kaya mo naman tiisin na hindi kumain ng matitigas, di ba? Kaya?
Yung matitigas, doktor, hindi na siguro kasi natatakot na.
Kaya natin habang buhay. Ako rin hindi na ako kumakain ng matitigas. No?
Pero ngayon, kung may ganun, hindi na.
Kaya nga. Kung kaya mo nang gawin yon for the next 10 years, sabihin natin 10 years ka pa mabubuhay, wag na lang. Okay? Baka yung iba pang mauna sa iyo, no? Ibang sakit, di ba? Okay? As long as it's not bothering you very much, no? Hold on na lang, tiyaga lang. We don't have a perfect body naman eh. Hindi tayo magkakaroon ng perfect body. Sigurado may mga problema. Lilitaw, importante, how to adjust to it, no? Okay? Anong payo sa iyo? Magbe-brace ka na? Mahal-mahal lang brace.
Hindi naman brace, doktor. Yung parang may ilalagay lang siya na parang ipin na pag ganun dito sa baba para makorek daw yung alignment ng aking...
Okay. They just call it brace na rin. Generic name for is the brace na rin. No?
Kasi naano ko naman siya, parang espesyalista naman niya yung doktor. Yung nakita ko yung diploma niya parang meron parang pinag-aralan naman yung TMJ, mga ganun. Parang meron siyang TMJ disorder.
Hindi, magbasa-basa ka pa rin. Baka kung minsan, there's a drawback kung masyadong maraming alam, baka mag-over-treatment naman sila. Di ba?
Opo, doktor. So, sino ang gagamot talaga, doktor? Medical doctor or dental? Is it medical problems or dental problems ito, doktor?
Yung TMJ can be kung talagang may sakit, no, na kailangan gamutin, at the moment, may mga dentists who can do it, no? The moment, may mga ENT who can do it, no? Okay. So, yun ang dalawa. Pero ang pinaka-importante malaman kung talagang kailangan gamutin, no? Baka hindi naman kailangan gamutin. Yan ang unang ano mo. Parang sa GERD, hindi naman lahat ng GERD dapat gamutin. Lahat ng doktor ginagamot. Di ba? So, importante yung malaman mo when to do it and when not to do it. Kung when that you can adjust to it, yung lifestyle mo, na hindi mo na kailangan magpa-opera, magpalagay ng mga braces, gano'n. No? Okay?
Okay, Doktor.
Any more? Any more questions sa neck mask?
Pwede pa isa, Doktor?
Ano?
Pwede pa isa?
Okay, sure. Sige.
Kasi Doktor, nung one time, pumunta ako sa yung may nakita akong mama, na ang laki ng bukol niya dito sa pisngi, yung binilhan ko ng baliwag lechon, naalala kita, kasi naalala ko yung sineseminar natin. Para bang naawa ko sa kanya, sabi, uy kuya, sabi ko, patingnan mo yung bukol mo sa pisngi, baka mamaya kung ano na yan, sabi ko, Doktor, sabi niya, wala naman akong pera, sabi niya, kung lumapit ka sa PGH, kasi oo nga po, ma'am, biglang lumaki, sabi niya sa akin, ang laki-laki nga dito na, Doktor, sa pisngi. Saan kayo pwedeng lumapit yun, Doktor? Kasi para pa nakakaawa din naman yun.
Kailan mo siya nakita?
Dok, nung Wednesday lang, nung May 3.
Punta na sa akin.
Doktor, ang laki dito niya sa pisngi. Sabi ko, patingnan mo yan, baka cancerous na yan. Sabi ko nga naalala nga kita, Doktor, sabi niya, wala naman akong ma'am, sabi niya, kasi siyempre, parang nag-ano lang ng manok doon sa baliwag lechon. Sabi ko, teka nga, pag nag-ano kami ni Doktor, mabanggit ko nga, sabi ko nga, Doktor
Papunta mo sa akin para matulungan. Kasi, dapat hindi yung excuse na na walang pera. Na?
Doktor. Sabi nga niya,
kahit na walang pera, may parang paraan pa rin. Kasi may gobyerno naman tayo na tumutulong.
Sabi ko nga, doon kayo lumapit sa PGH o kaya doon sa doon sa DMA Foundation, sinabi ko pa nga sa kanya, lumapit ka sa mga kwan. Huwag mong pabayaan yan kasi biglang lumaki, sabi po niya, laki na dito, Doktor, sa pisngi niya. Bilog na lumps nga dito. Sabi ko, patingnan mo.
I-convince mo na lang. Kasi I suppose maraming tao na doktor po na handa tumulong, no? So, pero kadalasan kasi yung mga tao mismo na pinapabaya no? Nagpapabaya, no? Okay. Mag-give up na kagad. Ay, wala akong pera. Kahit na maliit pa lang. Ay, wala akong pera. Pabayaan mo.
Parang may nilapitan yata siya, parang ang mahal naman, parang sabi niya. Parang may nilapitan ako, pero ang sabi, ang mahal. Kaya ayun, sabi niya.
Marami naman diyang libre, marami diyang nagtutulong, no?
Parang nakakaawa nga din, sabi ko, sige pa, babanggit nga kita, kaya sabi.
Sige, hindi. It reminds me of, ngayon lang, kahapon lang, may isa akong pasyente na ang laki-laking bukol dito. Sabi ko, bakit mo pinabayaan? Laki-laki na, gano'n. Walang pera daw, walang pera. So, pumunta sa isang government hospital, tinawagan ako. Ngayon, hindi mo siya ma-admit, matagal na ang scheduling. Ay, tinulungan ko, pinasok ko sa Hospital Maynila. Ngayon lang. No?
Pag mapuntahan ko siya.
Hindi lang ako, marami. Baka mapuno ako yung mga pasyente.
Kaya sabi ko nga.
Kaya ako kahapon na-stress ako nag-telemedical kami, ang laki-laki, tapos hindi ma-admit sa isang government hospital. Ayoko nang banggitin saan. No? Talagang sabi ko, kung sa PGH kayo, mahirap din pumasok, di ba?
Mahirap nga din sa PGH, Doktor.
Kaya, buti na lang, pumilit na magpa-admit sa PGH, pipila na lang daw sila, ready silang gumastos, no? Sabi ko, malaking magagastos mo kung sa private ka, no? Kasi malaki yung bukol niya no? So, tinawagan ko yung Hospital Maynila, nagbigay ako ng tulong, ayun, ina-admit ko, no? Ngayon lang, lumipat na sila from PGH to Hospital Maynila, no? Ganon. At least charity hospital, no? Okay. Any more questions on the neck masses? Sa neck na tayo, neck. Doon tayo mag-focus sa neck. Yeah, okay, Maria, basta.
Yung ano lang po, I want to ask, kasi yung may kilala po ako, nagkaroon siya ng non-Hodgkins.
Oo, lymphoma.
Oo, ay, namatay na nga po. So, ano ho yun? Dito kasi sa ano yung nag-manifest yung bukol niya eh.
Sa leeg.
Dito sa...
Kadalasan
Pero
dyan.
doon, oo. Pero pwede rin ho ba sa ibang lymph nodes?
Oo, pwede. Usually, yung buong katawan natin maraming lymph nodes. Usually nakafocus dito sa may head and neck, doon sa drawing ko kanina, sa side. And then dito sa kilikili, meron din. And then sa singit, meron din. Yan ang pinaka-main, no? Okay, kamisan sa loob ng tiyan, sa spleen, meron din, no? So, ang pinaka-common presentation dito, no? Ngayon, pag meron akong may pasyente na maraming kulani rito, kung nagsususpecha ako possible lymph nodes, i-check ko yung sa kilikili niya. Kung meron din, no, 99% lymphoma na yon, no? Okay. Then, ibabiopsy na lang to determine anong type ng lymphoma kasi ibang gamutan sa different types of lymphoma, no? Okay. So, usually, ang gamutan nyon will be chemo, walang operasyon yan, hindi operasyon, chemo and radiation, no? Ganon. No? Okay.
Okay, thank you po.
You're welcome.
Doc,
Any more? Yeah.
Doc, ako po.
Okay, Rowena.
Apo, good afternoon po.
Ah,
Doc, yung anak ko po kasi na 7 years old, bali po, yung mga nakaraan, parang nasa 6 years old pa lang po siya, no? Parang last year po yun, na may na-observe po ako dito na bukol sa kanya. Pero ngayon po, chinek po ulit, wala na po. Minsan po, parang, siguro twice ko po napansin yun ng mga last year. Tapos ngayon po, chinek ko po ulit, wala na po. Ano po kaya yun, Doc?
non-specific lymphadenopathy, yan ang tawag doon. Non-specific lymphadenopathy, yan ang tawag ko, ha? Okay.
Apo.
So, it's a lymph node, it's a enlargement of the lymph node, no? Na kusang mawawala over time. Parang yung sa akin, yung tinuro ko ngayon, yung sa akin, no?
Apo, yun
Okay.
dito po. Apo.
Kadalasan nawawala pag nawala na yung infection somewhere, no? Okay.
Apo.
Pero kuminsan, ayos siya mawala, steady na lang siya, hindi siya lumalaki. Parang peklat na lang yan, gano'n, no?
Actually po, Doc, yung po naanuhan po eh. Lagi pong minsan po,
Dandruff.
naoperahan na po dito, gawa po ng, sa kalikutan po, sa ulo. Possible po na gawa po ng sugat yun, Doc.
Ay, kung sugat, sandali lang. Mawawala na kagad yon. Okay. Right after the treatment dun sa ulo niya, baka lalaki siya for 1 week. After that, mawawala na. No?
Okay po.
Okay. Pero kung
Thank you, Doc.
kumisan, pag mayroong mga dandruff, may mga
Apo.
pwede din lumaki yung kulani sa side. No? Okay.
Dito po yung Doc nakakano
Yeah.
po.
Usually sa likod yon, no? Okay.
Apo.
Usually pag may mga ubo naman, ubo-ubo, sipon, dito lumalaki
Apo.
ito ng konti sa baba, no? Okay.
Possible din po ba, Doc, na yung pong namaga dito, gawa po ng sirang ipin po pag sa
Pwede.
bata?
Okay. Pwede. Kaya nga, yan ang focus ng infection. Yan ang original, no? Na
Apo.
source of infection. Pag nagka-infection, yung lymph nodes lalaki. Kasi yung trabaho ng lymph nodes, pinoprotektado tayo dun sa mga spread ng infection. So lalaki siya, magkatrabaho siya. No? Pag nawala ng infection, liliit na siya ulit. Magsasubside na siya. No? Okay?
Apo.
So
Dito, Doc.
pag may mga kulani, no, number one, pag-isipan ninyo, hanapin niyo kung may explanation. Baka may infection somewhere, may inflammation, no? Pag wala, i-observe niyo muna for 1 week, 2 weeks, no? Okay. Kung mawawala, no? Kadalasan kusang mawala. Pero kung di siya mawala, no, pa-check mo na kaagad. Pa-check na. No?
Okay.
Okay.
Thank you, Doc.
Huwag nating hintayin na malaking malaki. No?
Apo, maraming salamat po.
Mm. Okay. Any more? Any more questions? Wala na?
Wala na siguro.
So nakakita na tayo ng thyroid, ang pinaka-common, number 2, lymph nodes, no? So iba naman, lymphoma, TB, yan ang 4, no? Among the lymph nodes, ang pinaka-common, yung mga non-specific, no? Kaya may awa pa rin ng Diyos, majority are still benign, no? Kusang nawawala, no? Okay. Okay. So kung wala nang tanong, wala na, last call. We'll call it a day, and then we will have the next lecture will be on thyroid goiter boschio awareness. Okay. Thyroid. Kasi it's still part of yung May, kasi May is Thyroid International Day, no? Kaya ako tinatawag lang doon, no? Okay. Okay?
Okay, Doc. Thank you very much.
Thank you po, Doc. Maraming
Okay.
salamat po.
Bye-bye.
Thank you, Doc. Thank you.
Thank you, Doc. Bye.
Thank you po, Doc. Happy weekend.
Same to you.